Hello, my name is Darlena Brockway, and this is a presentation on my capstone project titled The Utilization of Predictive Modeling in California's Pulmonary Health Data. This is for course HCIN 546 for the Healthcare Informatics capstone taught by Dr. Tony Rosales. My capstone project will be about utilizing predictive data modeling for the purpose of population health management. Predictive data modeling is the statistical process of analyzing trends in data to predict outcomes or future events. This analysis tool can be applied for population health management purposes, such as the ability to predict points of interest. These points of interest include high-risk groups, correlating factors, and population health trends. A real-world example is California population health management. The major population health concern is respiratory illness, which includes chronic obstructive pulmonary disease, lung cancer, asthma, and etc. I have firsthand experience of the community affected by respiratory illnesses. Some state attributes include poor air quality and air pollutants, such as wildfires, high traffic, and industrialization. The predictive data modeling will utilize a predictive data analysis model curated by a healthcare informatics professional, which includes 3 steps. The first step is design of measurement instruments. The second step is interpretation of results. And the third step is application of interventions. The first step, design of measurement instruments, will utilize data sources from the American Lung Association Lung Cancer, the CDC, and San Diego's HCSA databases. The variable of interest identified is the COPD rate in California's population. Predictor variables include location, exposure to harmful pollutants, and smoking rate. The second step, interpretation of results, will utilize exploratory clustering for the purpose of identifying data trends by clustering instances. This methodology proved the trend of location is associated with higher rates of COPD. Some interpretation of results include that California places above average tier in national rates for lung cancer, and random sample data points prove that rural populations in California were more at risk to the urban populations in terms of COPD rate. Some tables and graphs included show the data sourced and proved results. This first table showcases how California places third among all states in terms of lung cancer rates, showing concern in population health. This next graph is taken from the San Diego HCSA registry, showing the total death rates of COPD in San Diego County regions. This shows how the eastern rural rates are more at risk to death when it comes to COPD compared to urban cities, such as Laguna Pine Valley versus an urban city like Mid-City. The third step, application of interventions, include the purpose of predictive data modeling, which is to predict vulnerable populations to the population health issue and provide evidence for resolutions. In this case, the high-risk group identified is California's rural subpopulations. Some stakeholders are patients at risk, healthcare executives, and legislators. A possible resolution could include increasing access of care to these high-risk groups. The evidence include that increasing care can lower overall healthcare costs associated with high rates of COPD. Other predictor variables found in the predictive data modeling include smoking rate, radon exposure, and air pollution. The interventions can include identify variables such as lowering smoking rates and decreasing exposure to these pollutants. Lastly, future opportunities for the Capstone include further healthcare initiatives, such as increasing healthcare access to vulnerable communities, such as the rural subpopulations identified, as well as anti-smoking education and marketing, and air pollution management. Some study limitations identified include further research needed, such as more evidence needed for the impact of the predictor variables identified, as well as data concerns such as advocacy for proper data collection and use, including accuracy of valid data and ethically sourced data.